All right, today we're going to play medical detective. We're diving right into a real-world case where a patient has these symptoms that, well, they just don't seem connected. But they all point to one single hidden condition. So let's see if we can solve it.
So I want you to imagine you're a doctor for a second. A patient walks in and her symptoms are, well, they're puzzling. And what's worse, they're getting progressively worse. It's your job to connect all these strange dots and figure out what on earth is going on inside her body.
Okay, so our story begins with a 60-year-old woman. She's on a pretty high dose of prednisone, that's a strong steroid, for her rheumatoid arthritis. But now a whole new set of problems is popping up. Let's take a look at the clues, shall we?
So here are our three main clues. First, progressive weakness. Then, this really deep fatigue. And finally, a swollen face. And listen, this isn't just, oh, I'm a little tired today. We're talking about something more significant. These symptoms aren't random at all. They're actually screaming a very specific diagnosis. Okay, so when you put all the pieces of this puzzle together, you look at her history, the medication she's on, and this very specific group of symptoms, the diagnosis starts to become crystal clear.
The answer? It's Cushing syndrome. And this patient's story perfectly sets up what we're talking about today. See, this isn't just some random medical term. It's the key that unlocks this entire mystery. But what exactly is Cushing syndrome?
So here's the big takeaway. This condition is all about having way too much of a hormone called cortisol. You've probably heard of cortisol as the stress hormone, right? But it does a whole lot more. And when your cortisol levels go completely haywire, it can throw your entire body off balance.
Which, of course, leads to the next big question. If the problem is too much cortisol, where is all this extra stuff coming from? Well, turns out there are two main ways the body can get overloaded like this.
So on the one hand, the body can start making too much cortisol all on its own. This is usually because of tumors on the pituitary or adrenal glands that just kick production into overdrive. But then there's the other way. And this is the key to our patient's story. The excess cortisol can come from the outside, from taking certain medications.
And bingo, this brings us right back to our patient. Remember, she was on high-dose prednisone for her arthritis. Well, prednisone is basically a synthetic, man-made version of cortisol. So, in a strange twist, the very medicine that was supposed to be helping her arthritis was actually causing this whole other major problem.
Okay, so we've got the diagnosis, Cushing syndrome, and we know the cause was her medication. But how exactly does having too much cortisol lead to those specific symptoms we saw at the start? The weakness, the fatigue, the swollen face? Let's connect those dots.
All right, here's the science behind it. The main bad guy here is that super high level of cortisol. It messes with the body's ability to build and maintain proteins. In fact, it does the exact opposite. It causes the body's proteins, especially in your muscles, to literally start breaking down. And this protein breakdown is what leads to that classic set of symptoms, the muscle weakness and fatigue. Yep, that's a direct result of losing muscle tissue. And it also explains that very specific pattern of weight gain, especially in the face, which gives that puffy, round look doctors call a moon face. See how all the clues from our patient's case just snap perfectly into place?
Sometimes the best way to understand what something is to understand what it isn't. So let's do a quick comparison to a couple of other conditions to make things really clear.
So we know Cushing syndrome is a problem of too much cortisol. Well, on the flip side, you have something called Addison disease. It's also an issue with the adrenal glands, but it's the polar opposite problem. It's caused by not enough of these steroid hormones. So think of them as two sides of the same coin. One is too much, the other is too little.
And hey, just to be super clear, let's also not confuse this with Graves' disease. Graves is also a condition of too many hormones, but it's a completely different hormone from a completely different part of the body. That one's all about the thyroid, not cortisol. Different system, different problem.
So, just to wrap this part up, we've managed to unpack a pretty complex medical condition. We looked at the cause, how it works, and the symptoms, all just by following the story of one single patient.
And this whole story leaves us with a really important, kind of tricky final thought. The medicine that was helping our patient's arthritis was the same thing that caused her Cushing syndrome. And this really shines a light on a huge challenge in medicine today, right? Powerful treatments often come with powerful risks, which leaves us with this big question. How do doctors and patients even begin to navigate that incredibly delicate balance between the good a treatment can do and the harm it might cause?